How does the Pap test detect high-risk HPV? Imagine catching a glimpse of tiny changes happening inside your cervix before they turn into something more serious. The Pap test is a powerful tool that helps do just that. But how does it work when it comes to high-risk human papillomavirus, or HPV? Well, the Pap test itself does not directly find the virus. Instead, it looks at cells taken from your cervix under a microscope to spot any abnormal or precancerous changes. These changes can be caused by an infection with high-risk HPV types, which are known to increase the risk of cervical cancer. When your healthcare provider performs a Pap test, they gently scrape cells from the surface of your cervix. These cells are then stained with a special dye called Papanicolao stain, which makes it easier to see any irregularities under the microscope. If abnormal cells are found, it might suggest that an HPV infection has caused changes in the cervical tissue. However, the Pap test cannot tell whether HPV is present or which type it might be. To specifically detect high-risk HPV types, a separate test called an HPV test is used. This test looks for the genetic material of the virus itself. It uses molecular techniques like polymerase chain reaction, or PCR, to amplify and identify viral DNA from the cervical cells collected during the same exam. The HPV test targets specific regions of the virus's DNA, such as the L1, E6, or E7 genes, which are crucial for the virus's ability to cause cancer. In clinical practice, there are two main ways these tests are used. One is co-testing, where both a Pap test and an HPV test are done on the same sample. This combined approach helps catch early signs of potential problems by identifying abnormal cells and high-risk HPV infections at the same time. The other method is primary HPV testing, where only the HPV test is done first. If the test is positive, then a Pap test or further diagnostic procedures follow. It's important to remember that a normal Pap test does not necessarily mean you do not have an HPV infection. The Pap test only shows cellular changes, which might not be present yet, even if the virus is there. Conversely, if the Pap test shows abnormal cells, testing for high-risk HPV can help determine if the infection is contributing to those changes. Understanding this distinction is key to effective screening and prevention. Both tests work together to assess your risk for cervical cancer, especially since persistent infection with high-risk HPV types is a major cause of cervical cancer. While the Pap test detects cellular abnormalities caused by HPV, the HPV test confirms whether high-risk virus types are present. This combined knowledge allows healthcare providers to make informed decisions about follow-up care and prevention strategies. Always consult your healthcare provider for personalized advice and screening recommendations. Regular screening is essential for early detection and reducing the risk of cervical cancer. Remember, staying informed and proactive about your reproductive health can make a real difference.